Jessica, why are you laughing? What's so funny? Why are you laughing?
I can't stop.
Why are you laughing, Jessica?
Me, Matthew Holt, it's Telehealth Awareness Week. You, no.
I think it's better say it's the September 24th edition of Health in 2.00. Jessica, I wasn't aware that it's Telehealth Awareness Week.
That was not I'm not aware, no. That was like a for fuck's sake kind of no.
No, okay, so we're aware of Telehealth.
Why are you so surprised?
No, come on, where, how, who decides, and how do you find out that it's Telehealth Awareness Week? Seriously,
it's all over Twitter. I don't know what you're doing. Tweeting about baseball,
I'm tweeting about baseball and the Giants and the Dodgers and the epic.
Your refrigerator. Perhaps you should focus on what's going on.
I still know who decides that it's Telehealth Awareness Week.
I believe the ATA has deemed this telehealth awareness, although I'm not entirely sure. That's
so Joe Cavado woke up one day and said, "I'm the head of the ATA. We're going to make it this week that we're aware." Oh, I have a Joe Cavado link for you in the 2 minutes when we get there.
Oh, okay.
So Joe Cavado, who is from Boston, used to run the Connected Health Conference from Math Partners, great guy, pioneer in all this telehealth, connected health stuff. Now head of the ATA, along with, oh God, who's the CEO? I know so well.
Anmon Johnson.
Anmon Johnson, thank you. With Anmon Johnson is the CEO. He's the chairman. And presumably they're the ones who decided that we should be aware. So are you aware?
I think so.
Are you woke about telehealth?
Are
you telehealth?
All I know is that I'm aware. I'm incredibly aware of telehealth this week more than any other.
Have you been using it this week?
I have not been, although what I've been aware of is that nobody's calling it telehealth anymore. Everybody's calling it virtual care or digital care. So I don't know what happened.
Maybe they're not, maybe no one's aware of it anymore. Maybe
unless those are different things, and they might be, it's like different flavors. I don't know. I need like a dictionary here.
All right. Let's go talk about whatever the hell will happen this week.
Okay, let's do it. Pager gets $70 million, brings their total up to 132 and some change. Matthew Holt, talk to me about Pager.
Pager came out of New York a few years ago. Gerald Dupasny, I think his name was, the French guy who started it.
Sure.
It evolved into, it started out being like an online treatment thing, evolving into a navigation program. They're big, it has all the tools you have for navigation plus communication. Their big clients are Horizon Blue Cross New Jersey and Cambia, the Blue Cross plan in the Northwest. Selling that stuff to health plans is pretty tough, but you get a couple of big clients, you're stuck there for a while. Good luck to them.
Okay. Ovivia gets 80 million, brings their total up to 127. This one's based out of Europe, right?
Yeah, it's German based. I think it's German, Austria, Switzerland, going to the UK. It's the kind of another Livongo type diabetes care program, chronic care management. The reason I stuck it in there is it's happening. This deal was a couple of weeks back, but it's happening in Europe now. A lot of big deals in Europe. We've done, I count like 15 for a presentation I did this week.
Oh, you have a chart. Our friends over there at mental health startup Meru Health, they land $38 million, still such a hot space. Brings their total up to 51. Yeah,
Christian Renter, CEO there, is doing a nice job. They have a kind of multimodal approach, which involves a bunch of texting, some live visits, but a little bit less than some of the others. A lot. They were on the panel with which we'll release at some point at Mental Health from our conference the other week. They also do a sort of relaxation peer-to-peer. They have a bunch of multimodal stuff in there. They wrote a paper. Christian wrote a paper with Joe Cavado the other day about how it all works. So well on them.
All right, what about NOCD? I always say that wrong. NOCD, they land 33 million, brings their total up to 50. More money for this one. I thought they had just raised money, but you said it was a year ago.
Yeah, they raised about 12 a year ago out of our friends at 7wire who've been pushing this hard. This is a mental health app using cognitive behavioral therapy and some other stuff specifically for people with OCD. which and you told me they're creating a new market category called community-driven therapy. I don't know what the hell that means, but it's an example of the nicheness, right, of mental health, because we got so folks like Meru and then Ginger and all those, they're doing kind of depression and anxiety, the two big categories they most have. But then you add in, people doing substance abuse disorder, or people looking at suicidal stuff, or people doing other kinds of addiction, or or whatever else. And now you have somebody saying we're just going to take OCD and slice that out. It seems again like a lot of money for somebody in a very narrow niche, but I guess a lot of people have OCD, and if it works, great stuff.
Well, yeah, I mean, I would imagine it's expensive too to treat. So if they can put any of it offloaded onto a.
Yeah, I mean, obviously, it's one of those things where it's probably very hard to find a therapist, because it's hard enough to find a therapist anyway. Finding one who specializes in OCD is probably really, really tricky. So that's it. F Prime's in this round. I think Kaiser, a bunch of other people in this. So,
yeah, this was a loaded round. 7ware was in this one again too. There's a bunch of investors in this one.
So good luck to them. Hope it'll work out well.
Yay! Mental health continuing to boom.
No, I mean it's real, right? So as I said, I gave a talk to this European drug company earlier this week, and I asked them where they could put their money. A lot of them said, yeah. I said, if you theoretically had, a big Swiss pharma company's money and you could put it wherever you like, they were, a lot of them talked about analytics, a lot of them talked about mental health. So I think it's an interesting place to go, especially as a company which doesn't have much mental health stuff in its current portfolio. Although this is one of those innovation groups which, does what the hell it likes.
Well, and to come back to Telehealth Awareness Week, I feel like the mental health space has really been the shining use case for. Oh,
no question. I mean, there's some data that Crossover put out today, our friends at Crossover.
Yeah.
About their usage, right? And basically they said that, as you'd kind of think, post-pandemic, almost all their mental health stuff is done online. The normal care, normal primary care has been done half online, half offline. And the physical therapy type care is being done in person. Although there are a bunch of people trying to develop, I've been judging the UCSF Health Awards, and there are a couple of interesting people in that who are trying to do physical therapy, online. And there's a bunch of other people who know Hinge and others trying to do physical therapy and MSK stuff online as well. But that's the bit that Crossover's having the most trouble moving to virtual. So, not surprising.
No, interesting stuff.
I mean, I still do have to go back that, if we look at the companies we just talked about, these are really big rounds for companies that are mostly have competitors in established space. NOCD probably will be taken out by one of the bigger mental health companies eventually. Meru has got an interesting approach, but it's a relatively small round compared to like Spring or Lyra or whatever for a company that's a bit smaller. Pager, talk about navigation, well, how many competitors there are in that space. And then, diabetes, chronic care management. Maybe you could get Germany, but my God, that's a crowded space. So, it's not like people are coming up with radical new ideas at the moment.
No, it just seems like the field of what's getting funded is it's kind of like the next wave, or it's like, and the thing too, it's like, I think we've already seen so many different acquisitions this year. And it's like, I'd imagine there's got to be some of these companies that are sitting there that are at this size or smaller who are like, which way do you go? Do you take the money and try to scale and like give it a go against some of these like other startups that have so much more money than them? Or do you just become, rolled up?
Look, and if we go back to the presentation that you made at Policy Sticky Species, What's Next Healthcare, a fantastic conference that you can still look at the archive of, and we have to cut some deals people want to come in and buy the archive late. But you had a great chart in there about M&A, and you think about Amwell by picking up, what was it, Conversa, and picking up
and Silver Cloud.
Silver Cloud. You really say, how can we flesh out our product line? But somebody who's got some clients, but really are intended to take that product set and put it into other things. And I think, Pager may be too big for that, but the rest of these folks on this list are probably heading in that direction. But we will see, and there's more.
Yeah, and it could look like a Ginger headspace where it's like a merger of equals in some cases. You know what I mean?
In some cases, but you got.
In some cases, I think there's still some room for that, especially in the mental health space, where it's like they've got a piece of it, or they've got like clinician focus versus machine focus. I mean, I think there's a lot of opportunity there for some interesting.
I think there's a massive opportunity to create a conference where all these companies talk to each other and end up, and the host of the conference.
I believe we've already done that.
Get 10% of all the deals that get made.
Oh, if only.
5%, 1%.
Especially you, because I'm sure you saw a lot of these startups when they were early.
Well, I mean, that's way back when. I'm thinking of reconstituting I'm reconstituting my business model for the next set of conferences. So I get something. All right. You should get us out of here because we're now just walking.
Yeah, seriously. To send your reparations for your digital health startup success to Matthew Holt, please find him over there at Bolty Boy. I don't know what you would call it, like the payback kickback from your 10 years on stage at Health 2.0. Send him a note over there at Bolty Boy on Twitter. I am over there at Jess Tomasa, and you can subscribe to the Healthcare Blogs newsletter at thehealthcareblog.com. Never miss an episode of us. Find out what's happening on the blog, so on and so forth.
Okay, so do you think the Giants are going to hold it off and win the division? You don't
I
care.
have no idea. I'm a long-suffering Cubs fan.
You certainly are suffering this year, especially you sent us your best player for like,
Thank God I have 103 years of experience doing that, right? So
you sent us your best player for a bag of peanuts.
We got rid of everybody. I don't even recognize this team anymore. My mother is heartbroken. She's where I get my Cubs fan-ness. All
right, we better let the long-suffering viewers of this show who don't care about baseball go.
Bye.